trend in the field where patients are going in, they're getting their teeth, they're flying in from Florida or from Washington or wherever.
Yeah.
They're coming in and they're getting their teeth in a day. They do the surgery, they send them away, they make a final prosthesis, they put it in the next day, they send them home. 6 months later, there's a gap under it.
Yeah, we don't want that.
And now you're spitting food through there, there's bubbles, it's a mess. And either that, or I have to do what we call a ridge lap. So if I don't want to deal with the gap forming, then I make a little lip, a ridge lap, so it overlaps your ridge. So if you do, like if it's sitting here like this and you have this much shrinkage, you won't even know it because the prosthesis is sitting so high that
you wouldn't see it.
You wouldn't see it. The problem is that now I've got this lip and then you get a bunch of fake, or no, you just get a lot of food in there.
Yeah.
And it's constantly dirty.
Oh,
You can never clean it.
Yeah.
So our goal is to make this as flush to the gums as possible so it doesn't overlap. We don't want any overlap. If we can avoid any overlap at all is what we want.
Okay.
So we want it basically right here. Now if that shrinks, you're going to get a gap. So we need to wait until your gums shrink before we make the final set so that we know where the position. The good news is after about 6 months, they stop shrinking.
Okay.
Not like a denture where you get it relined and 6 months or a year or two later, there's a gap. You got to reline it again. That's because the compression of the denture causes the blood loss, or the gingival tissues don't have good blood flow. They're being compressed and it causes the bone to shrink away. And then it stabilizes, and then you reline it and you tighten it up there again, and it compresses again, and then the bone has to remodel again. But with this, it only remodels one time. So it'll remodel, it'll find its equilibrium, and then we're never going to put a ton of extra pressure on there again. So we'll just have it nice fitted kind of perfectly. And